Did you know you can get pregnant even before your first period returns after giving birth? That surprises many new moms, but it's absolutely true. Welcome back to the channel. Today, we're diving into a really important topic for new mothers: birth control after childbirth. Whether you're breastfeeding, bottle feeding, or still recovering, knowing how your body works and which contraception options are safe is crucial for your health, recovery, and family planning. After giving birth, it takes time for your body to recover and for your menstrual cycle to restart. But here's the key point: you can still get pregnant even if your period hasn't returned yet. This is because ovulation, the release of an egg from the ovary, can happen before your first postpartum period. So yes, if you're sexually active, pregnancy is possible. If your baby is exclusively breastfed, meaning your baby only gets breast milk, with no formula or solid food, your chances of pregnancy are lower during the first few months. Still, breastfeeding alone doesn't guarantee protection. Did you know that ovulation can return before your first postpartum period? Comment below if this surprised you. Some women rely on breastfeeding as birth control, a method called lactational amenorrhea. Let's break that down. Lactation means milk production, and amenorrhea means absence of periods. For this method to work effectively, all of these must be true. Your period hasn't come back. Your baby is under 6 months old. You exclusively breastfeed, no formula, no solid food. You breastfeed every 4 to 6 hours, including nights. You nurse directly, not with a pump. However, even when done correctly, it's not as reliable as other birth control methods. So, if you definitely want to avoid pregnancy, consider additional contraception. Let's look at your main options, because birth control isn't one size fits all. Each type works differently and fits different lifestyles or goals. First, we have long-acting methods. These include intrauterine devices and implants. They prevent pregnancy for years and can be removed anytime if you want to conceive again. Next is permanent procedures. If you're certain your family is complete, options like tubal ligation, getting your tubes tied, or your partner's vasectomy make pregnancy impossible. These are surgical, permanent solutions. Hormonal birth control. These use hormones, either estrogen, progestin, or both, to prevent pregnancy. Examples include the pill, shot, patch, and vaginal ring. They can also regulate or lighten your period. Barrier methods. These physically block sperm from reaching the egg. They include male and female condoms. Paracoidal methods. These are used right before sex, like diaphragms, sponges, and spermicides. Condoms also belong to this group. Natural methods. These don't involve drugs or devices but require timing and discipline, like withdrawal of penis before ejaculation and fertility awareness, by tracking your cycle to avoid fertile days. These methods are less reliable. If you had to pick one factor that matters most to you in contraception, effectiveness, cost, or convenience, which would it be? Choosing birth control is personal and depends on several things. First is future pregnancy plans. Do you want kids soon? Choose short-term options like pills or condoms. If not planning soon, choose long-acting ones like intrauterine devices. They are great. Doctors usually recommend waiting at least 6 months before getting pregnant again to give your body time to heal. Second is if you're breastfeeding. Some types of birth control use hormones to prevent pregnancy. Of these, some contain the hormones estrogen and progestin, while others contain only progestin. These hormones are not harmful for your baby. But many doctors recommend people who are breastfeeding delay starting birth control that contains estrogen for at least 3 weeks after giving birth. Safe options for breastfeeding include progestin-only methods, like the mini pill, and non-hormonal ones, like the copper intrauterine device or condoms. Third is when you can start. Some methods can start immediately after delivery, while estrogen-containing options should wait at least 3 weeks postpartum. Fourth is your priorities. Consider the following: how easy it is to use, cost, side effects, extra benefits, and whether you also need protection against sexually transmitted infections. What if birth control fails or you forget? That's where emergency contraception helps. There are 2 main types. First is emergency intrauterine device, which is the most effective and can be placed by a doctor. Another is emergency pills, available both over the counter and by prescription. The key is timing. Use it as soon as possible after unprotected sex for the best results. Always check in with your healthcare provider if you have the following. You have side effects or discomfort from birth control. You think it's affecting your milk supply. You want to switch to another method. You experience pain during sex or have concerns about breastfeeding. After giving birth, contraception isn't just about preventing pregnancy. It's about giving your body time to heal and helping you plan your next steps safely. If you found this video helpful, don't forget to like, subscribe, and share it with other new moms or healthcare learners. See you in the next one.